This program is brought to you by Community Trust Bank, Medical City, and the Neely School of Business at TCU. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
My next guest is Dr. Joshua Weiss. He's the Director of Specialized Perinatal Programs here at Medical City, Dallas. Dr. Weiss, welcome.
Thank you very much for having me.
Absolute pleasure. As a layperson, when I was reading a little bit about the FACT program before the interview today, I was just amazed. This is truly a soup to nuts program all under one roof. So why don't you give our audience a little background about how this all came about?
Well, several years ago, we realized that we had the opportunity to provide women care where they could not only have their pregnancy taken care of at this particular hospital, we knew that we had the ability to take care of their children as well. And the unique factor of Medical City in our FACT program is that women are able not only to have their children here and deliver here at Medical City, but then their children are able to have their surgeries or specialized care done under one roof. Right. So in this particular case, if a mother gives birth and delivers and the child needs surgery or needs anything specific, they're in the same hospital. So mom can visit the baby, they can be with the baby, and they're not taken across town or even across the street to another hospital where they're separated from their child.
Right. Yeah, it's traumatic enough to have a child with, a heart defect or a traumatic situation. So you're really addressing the needs of the whole family, not only your patient.
Absolutely. And one of the big issues is we want a seamless transition from the perinatal, the still pregnant world, to the postnatal and the post-delivery world.
Okay, so go back to that term perinatal. So that means pre-delivery.
Well, perinatal is basically dealing around the pregnancy and neonatal period. So technically speaking, it's during pregnancy to just after delivery. That's what that particular word is referring to.
How did you get into this area of medicine? Why maternal fetal medicine? Why did that appeal to you?
Well, maternal fetal medicine and perinatology are really the same thing. There's several years ago they kind of changed the terminology to maternal fetal medicine, which is the more common reference today. When I was an OBGYN resident, we were fortunate enough to do a lot of different things during our residency and see different aspects of the OBGYN realm. And what really drew me to the maternal fetal aspect was the ability to do prenatal diagnosis, to help women understand if there are any problems with their pregnancy, and as well as help to kind of give them some options as far as treatment for some of the complications that can occur in pregnancy.
Well, let's talk about that, because I think that the importance of pre-delivery education to mothers, even in 2010, Dr. Weiss, I think there's still not a lot of knowledge about how to carry a healthy baby to term. So why don't you kind of go through the basics for our audience?
Well, in general, as far as education, most women's general OBGYN do fantastic jobs, especially here at Medical City, educating them about proper nutrition, proper vitamins and things to make sure that things are going well and make sure that their lifestyle is appropriate during the pregnancy. Unfortunately, during pregnancy, things can happen, and it's overwhelmingly not anything that the patient has done, the mother has done. It's just a force of nature. And some babies don't develop the way that they're supposed to. And then our job at that point is to educate them by, one, diagnosing this if we can. And the majority of things we are able to diagnose, but there are certainly many things that we are not able to diagnose prenatally. But once we are able to diagnose that, to really educate that patient as far as what to expect not only during the pregnancy, not only during the aftermath of delivery, but long-term down the road, 10 years, 15 years, what their life is going to be like. Because it's, when women and couples get pregnant, they're obviously extremely excited. Yep. But whenever they find out there's a problem with the pregnancy, this can be life-altering changes to them.
How would you say genetics, how significant are genetics in determining whether it's going to be a healthy pregnancy?
Genetics play a huge role. But there is a wide range of what genetics do and what complications are. There are many abnormalities that we find that are due to genetics. advancing maternal age, women who are waiting later and later to have children, does increase those risks. But age is a very antiquated way of giving people a risk assessment for things such as Down syndrome, and so there are other testing options that we will often provide. Genetics also plays a role in specific mutations that may not have ever been in a family or known to be in a family before. And oftentimes you can have genetic problems that occurred due to the process of the egg splitting or the changes in the chromosomes with the sperm, as well as having problems in genetics where mom and dad carry specific mutations that they are normal, but when you have them together, it causes a problem
for the baby, unfortunately.
Exactly.
Let's talk about some of the common procedures in your practice. Amniocentesis. Now, obviously, this procedure has been around for many, many years, but what is the purpose of conducting that procedure?
Well, as I alluded to a few moments ago, advanced maternal age has certainly been associated with Down syndrome, as well as other chromosomal abnormalities. The first step that I typically do in my office is not direct diagnostic testing, but screening, a specific screening to kind of get an idea what the risks are in a particular pregnancy. If that screening test then comes back abnormal, or the mother is concerned enough in general that they want to have specific diagnostic testing, then the ability to know what the chromosomes are for the baby are based upon diagnostic tests, invasive testing. And one of the more common ones that most people hear about is amniocentesis.
Right.
And amniocentesis is a test where you place a very thin needle into the fluid around the baby. You do it under ultrasound guidance.
Okay.
Yeah, you don't go through the belly button, and that's a very common misconception by women.
See, I'm the dumb layperson by design here.
And you know, I have this conversation multiple times a day and explain exactly what we're doing. And basically, we place a very thin needle after cleaning the woman's abdomen very, very well, and we do it under sterile technique, looking with the ultrasound, placing the needle into a specific spot where the baby is not, so we do not hit the baby. And withdraw some fluid and then send the fluid to the particular genetics lab, and they will then grow the cells out, look at the chromosomes, and know exactly what the chromosomes are.
Right. Another area that you're involved with is umbilical blood sampling. What is that?
Umbilical blood sampling is a test where you do similar to amniocentesis, but what you're looking for is you're trying to place that needle into the umbilical cord. That is a test that's really specific for complications of fetal anemia, where you're looking to know what the blood count is of the baby. Babies that are very sick based upon mom's body reacting and breaking down red blood cells, or some infections that can cause breakdown of red blood cells of baby and make them very sick. By doing that, you're then able to not only know what the cell count is in the baby, you can then transfuse that baby and keep that baby going and give very much better outcomes if nothing was able to be performed.
One thing I want to ask you, Dr. Weiss, is it's a very happy area of medicine you're involved with, but again, when there are problems with an unborn child, how do you as a physician, that's a very difficult thing to transfer news like that to one of your patients, so that's a whole other side of care that you have to address as a physician in this area.
It's interesting you bring that up. At least once a day I have a patient go, "You've got the greatest job ever." A lot of what I do is reassurance, and a lot of what I do is have women who don't necessarily have complications, but they're just being screened to make sure everything looks good, and overwhelmingly I give good news. My response is, when I give great news, it's wonderful, but unfortunately a lot of what I do is not always good, and that is very difficult. What I found is, as far as telling patients, is just to be forthright, be empathetic, and let them know what's going on, be direct, and try to explain not only what is happening, but what we're going to do from there. So they're not just told, your baby has a problem and walk out the room.
Exactly.
Your baby has a specific problem. This is what I think it is. This is what we need to do. This is what we're going to expect. I'm now going to have you see Dr. X, Y, and Z so we can all work together. And in reality, that is a lot of what the FACT program is. A lot of what a perinatalogist, maternal fetal medicine doctor is going to do is not only do the diagnosis, but then help to arrange the proper care. And by having our FACT program, we have a specific coordinator who is involved in all of our cases. Once we have a diagnosis, whether I make the diagnosis or it's made from an outside institution and then referred into us, we then make sure that our coordinator is in contact with that particular patient and that the required consultations are done in a very methodical manner.
Expedient, yeah.
Not only do they see the for example, a pediatric cardiologist if they have a congenital heart defect. They're also going to meet with the pediatric cardiothoracic surgeon. They're going to meet with the neonatologist because our baby's going to be in the neonatal intensive care unit. So we want them to not have their first experience in that area after the baby's born. We want them to kind of have an idea of what to expect. And heart is just as one example. Certainly we have a lot of abdominal wall defects as well, so the pediatric surgeons are highly involved, urologic complications, and many others.
Well, Dr. Weiss, obviously we're going to be interviewing some of your colleagues that you just mentioned in the areas of specialization through this wonderful FACT program here at Medical City Children's Hospital. I appreciate your time. It's fascinating information. For those of you who want to get more information or contact Dr. Joshua Weiss, he is the Director of Specialized Perinatal Programs here at Medical City Children's Hospital. Go to his website at jlweissmd, correct, .com. That's jlweissmd.com. Dr. Weiss, it's been an absolute honor having you on the program.
I appreciate it. Thank you very much.
Ladies and gentlemen, this is Siobhan Palmer with Platforms, the life-lifting news program for women. We'll be back in a moment.